Basic first aid techniques. Topics to be covered: the chain of survival, the do's and don'ts of basic first aid, the first aid kit, necessary equipment in a first aid kit, how to make proper and best use of the first aid kit, how to use face shields, how to put on a dressing, how to put on a bandage, how to bandage a hand, how to bandage a sprain, how to make an arm sling, how to conduct CPR, how to use an AED, rescuing someone from water and fire, making the accident place safe, break the contact with electricity, record keeping. The chain of survival. The chain of survival refers to a series of medical actions that can be taken to prevent a fatality when cardiac arrest occurs. It was a procedure first documented in the USA in 1981 and has been a trusted method ever since. It's known as a chain because each step is as important as the other and needs to be performed in methodical links. If they aren't followed in a timely manner, then the chances of survival can decrease greatly for the casualty. The 4 links are: try to prevent cardiac arrest, recognize the early signs of a heart attack and call emergency services in hopes of preventing it. Try to buy time. Early CPR, cardiopulmonary resuscitation, may help stave off a full attack until medical professionals arrive. Try to restart the heart. Early defibrillation can help shock the heart into a regular rhythm. Try to restore quality of life. Early advanced cardiac life support or post-resuscitation performed by medical professionals can help with a full and successful recovery. The speed at which each action is performed will greatly increase the chances of a full recovery. The do's and don'ts of basic first aid. When performing the basic forms of first aid treatment, there are some major do's and don'ts that should be remembered for injuries. Don't move the victim unless absolutely necessary or unless they are in danger. It could make injuries worse. Attempt to reset bones or obvious breaks. Just keep the casualty as still as possible. Delay in calling an ambulance if you have any suspicion of a life-threatening or changing injury. Try to tie a tourniquet around a limb when there is excessive bleeding. Use direct and gentle pressure instead. Apply ointments or gels straight onto a wound. Cover and/or clean it only. Try to remove foreign objects from an eye injury. Cover and protect the socket instead. Do's: call an ambulance immediately for major injuries. Check the status of the casualty on a regular basis. Keep calm and reassure all patients that emergency help is on the way. Check that a casualty is breathing without difficulty and their airways are clear. Wear protection on your hands and body to prevent cross-infection. Start to apply CPR if a cardiac arrest is suspected. Keep casualties warm or cool, depending on the circumstance. Call the appropriate poison control centers if poisoning is suspected. Assume a spinal injury has taken place during a fall or crash, unless certain otherwise. Raise the head if there is bleeding in the upper torso area, or feet if there is bleeding in lower torso areas. Flush burns, scalds, and chemical injuries with clean water. Remember, the first treatment given to a casualty can make all the difference in a crisis situation. First aid kit. Necessary equipment in a first aid kit. It is recommended that a first aider either carries or has immediate access to a kit that has these items as a bare minimum. A waterproof case of some kind. Assorted plasters, at least 20. Cooling gel for minor burns. A pocket mask or face shield. An emergency blanket. Latex-free disposable gloves. Safety pins. Splint material or emergency foam for immobilizing limbs. Scissors. Tweezers. Adhesive tape. Assorted bandages. An adaptable tourniquet or belt. Several sources of clear, sterile water. Assorted forms of sterile wound dressings, including an iPad. Antibacterial wipes. Painkiller. Motion sickness medication. Notepad and pen for record taking. How to make proper and best use of the first aid kit. A first aider should also be aware of how to make the best use out of these materials and ensure the first aid kit is always fully stocked and updated according to expiry dates and usage. Dressings. Use dressings to cover and protect wounds and cuts. Wear gloves before applying to the wound and make sure it covers the entirety of it. Never slide it into place, but place it directly over the top and hold the edges. Do not remove if blood seeps through, but add some extra dressings. Dispose of used dressings with the rest of the chemical waste to prevent the infection from spreading further. Adhesive dressing or plasters. These should be used as per the previous guidelines, but check that the casualty is not allergic to the adhesive. Clean the skin around the wound so that they will stick firmly. Like loose dressings, they should be applied directly from the top of the injury and positioned firmly by using the edges. Bandaging. Use bandaging to cover wounds from infection and to keep limbs in a supported position. It can be fastened by adhesive dressings, safety pins, or reef knots. It is important that dressings and bandages do not restrict circulation when secured. How to use face shields. A face shield is sometimes known as a pocket mask or a barrier device. It is designed to protect both the first aider and the casualty during the CPR process. CPR face shields come in many forms. In the rawest form, it is just a plastic sheet with a small valve. But all are manufactured to separate the first aider's face from the casualty. It allows the first aider to deliver rescue breaths directly and without fear of cross-infection. To use. Place the face shield over the casualty's face. Some have diagrams printed on them showing you the correct positioning of the mask. Open the airway by tilting the head. Place your mouth over the face shield, providing 2 breaths to the victim. Continue with CPR and rescue breaths until professional medical help arrives. How to put on a dressing. Sterile dressings are usually purchased individually. They come wrapped in different sizes for different areas and uses. The most common form is a dressing pad attached to a bandage. Bear in mind that once the packaging is opened, you are committed to using it or disposing of it. The best method to cover a minor wound or injury with a dressing is to unwind the bandage and ensure it remains sterile and clean. Unfold the dressing pad and place it gently on top of the wound. Hold the bandage to the side as you place the pad on the skin. Wrap the remaining length of bandage once around the limb or body and the pad itself to secure and protect the area. When happy with the placement, tie the ends of the bandage in a knot or secure them together with a safety pin. Follow the same procedure for adhesive dressings, but do not place any of the adhesives on the wound itself. In all cases, the dressing should never be too tight or prevent blood circulation. How to put on a bandage. There are several different first aid uses for bandages, and we will look at specific methods for certain injuries in the next few slides. Generally, though, they are used to control bleeding, support limbs, and secure dressings. If you don't have access to bandaging, then clean the area and use a strong fabric such as a scarf, which can be an acceptable alternative. There are some general rules that need to be obeyed when applying any kind of bandaging. Make sure the casualty is comfortable and calm prior to treatment. Stand or kneel at the side of the patient and try not to lean across their body. Use an appropriate size of bandage for the limb or wound. Make sure the injured part of the body is solidly supported in the right position. Don't cover fingers or toes completely when bandaging an arm or leg, as these can help check blood circulation. Secure the bandage with a knot, safety pin, clip, or medical tape. When complete, make sure the casualty is still comfortable, the skin around the bandage is not swollen, and there is no loss of sensation. How to bandage a hand. The most effective form of bandaging for a hand is a roller bandage. This type of bandage can be made from cotton, gauze, and elasticated fabric. It can easily be wrapped around an arm, hand, leg, or foot. The best way to apply this type of bandaging to a hand is by following the procedures below. Put the end of the bandage on the inside of their wrist, below the thumb. Wrap the bandage around their wrist at least twice. Then continue to wrap the bandage diagonally across the back or front of the hand. Wrap the bandage under the wrist again and repeat the diagonal wrapping method around the hand. Keep doing this in a figure-of-8 pattern. When the whole hand is covered with the fingers kept free, fasten the loose end with a safety pin or medical tape. Check the end of the fingers for circulation by making sure that colour returns to the skin after 2 seconds, following a pinch of the skin. Check the wrapped hand again every 10 minutes to spot any unnatural swelling. How to bandage a sprain. If the casualty has sprained a joint, elbow, ankle, and so on, a bandage is essential to support the limb and keep it from further injury. Like bandaging a hand, a tight figure-of-8 motion is the most effective way to cover and support the injury in a quick and efficient manner. The best method to follow is again using a roller bandage. Hold the joint firmly with it slightly bent. Put the tail end on the inside of the joint and pass it around the limb about 1.5 times to secure it. Wind the bandage as a figure of 8 around the joint, diagonally above and below the joint. Repeat this several times, covering the area generously around the sprain. Then wrap it around the joint again, tuck it in, and fasten with tape or a safety pin. Just as with the hand, allow the digits of the limb to remain free and check regularly for circulation issues. How to make an arm sling. An arm sling is essentially a hammock for the arm and is designed to hold either limb in a comfortable position, which will promote healing and allow bones to mend naturally. To a lesser extent, it also signifies a serious injury on a visual level, giving the casualty some welcome space. In order to create a sling, ask the casualty to gently support their own arm, or ask a bystander for assistance. Slide a triangular bandage under the injured limb. A triangular bandage should be a part of every first aid kit. Make sure the triangle is pointing away from the elbow of the injured arm. Bring the top of the triangular material around the back of the neck. Fold the lower end of the sling over the end of the arm and bring it up to meet the shoulder on the same side as the injured arm. Tie free ends of the bandage together in a knot above their neck. Work on the sling so that it comfortably supports the length of the arm all the way to the fingers. Use a safety pin to secure the knots further. As with all bandaging, continue to check for circulation issues and/or swelling that becomes apparent. In cases where you do not have a sling bandage, use a jacket, shirt, or belt to perform the same function on a temporary basis.